Hi Caroline, how are you today?
Good, how are you?
I'm good. I'm the PA. My name's Kate. I'm just going to be doing an EKG on you to kind of evaluate what happened to you at the gym, and I'm just going to take a listen to your heart first, okay?
Mm-hmm.
All right, Caroline, so I'm just going to put these leads on you, and the cardiologist and I are going to read your EKG when it's done, all right?
Mm-hmm.
All right, Caroline, so thanks for bringing your parents today. This is Dr. Morgan. She's a cardiologist here.
Yes.
So we're just going to talk to you guys a little bit about long QT syndrome, what it entails, what your treatment options are, and how we're going to manage your disease. Okay?
Can you tell us what this condition is?
Of course. So long QT syndrome is a heart rhythm condition that can cause fast and chaotic heartbeats. The most common clinical presentation is often fainting or a sudden cardiac event like what happened to Caroline on the treadmill. So it's often precipitated by something like an emotional stressor, an auditory, like traumatic event or exercise, like in her case. In severe cases, without treatment or a defibrillator, it can lead to sudden cardiac death or seizures. So the condition she has is most likely a congenital long QT syndrome. So it has a genetic component that's most likely passed down.
So one of us has it?
From her parents. That's definitely possible. It's usually autosomal dominant transmission. So we're going to run some genetic tests and figure it out. It is treatable. The condition is treatable, so it's going to be managed with medications that we'll talk about, such as beta blockers or antiarrhythmia drugs that will help prevent these erratic heartbeats in the future. Like I said, your fainting, such as at the gym, can be often brought on by palpitations, an uncomfortable awareness in your chest, lightheadedness, or an irregular heartbeat. So you'll be able to tell if it's coming on. You can have torsades and VFib, which can be clinical manifestations, but like I said, we're going to put you on some drugs, talk about putting in a defibrillator so that it wouldn't lead to sudden cardiac death. And if not reversed from the defibrillator, you'll have to, which is going to help put your heart back into normal rhythm. So that's what we're going to continue to talk about.
So is this something I've had my whole life?
So probably. So like we said, it's an autosomal dominant form of transmission. So one of your parents had a mutation in the gene, and most likely called a missense mutation. So this is what typically results in the clinical presentation of this syndrome. So the missense mutations are pretty serious, and they are the most common form of mutation that leads to the sudden cardiac death. There are some other mutations that have been found, such as autosomal recessive in this type of disease, but the most likely common form you have is the congenital autosomal dominant form of transmission. The mutations most likely occur in the potassium and sodium ion channels, which is what's causing your heart to go into these erratic and fast heartbeats. So the most common form of the phenotype which you have of the Romano-Ward syndrome presents with just prolonged QT elongation, which is what Dr. Morgan and I here found on your EKG. So this is what can result in fainting, seizures, sudden cardiac death, what you experienced on the treadmill yesterday, but can also range from any kind of heterogeneous collection of disorders. So would you guys like me to show you maybe a family pedigree from one of our genetic counselors?
Absolutely.
Okay, all right, I'm gonna go grab her out in the hallway real quick.
While we're waiting for the genetic counselor to get here, do you guys have any questions?
Yeah, how common is this?
It is pretty common in the congenital long QT syndrome that she has. It is like 1 in 2,000 patients. Mostly, the parents don't even know that they have it and don't have symptoms, but they're still still able to pass it on to their child, which can be seen through like genetic testing and things like that.
Well, I still need to know, like, is there any sort of testing that we can do to figure out if it came from me or if it came from the sperm donor?
Yes, we could definitely set that up.
Okay, perfect.
Hi, I'm Sarah, the genetic counselor. I drew up a pedigree for you guys to help clarify some things about your condition. As you can see, it's autosomal dominant, so you can see it within each generation. And if you wanted to do further testing, like you talked about with Morgan, we can facilitate that.
Thank you very much.
So there is genetic testing available for this condition. However, about 20% of the people who definitely have long QT syndrome have a negative genetic test result. And between 10 to 40% of people with a positive long QT syndrome genetic test result have a normal QT interval. So this makes this testing somewhat difficult. And in patients with fainting, especially upon physical exertion, like what happened to you, or emotional auditory arousal seizures, or cardiac arrest, family history of sudden cardiac death, genetic testing can provide important information about the condition that can help you guys figure out where to go from there. Performed with a cardiac evaluation, genetic testing can be used to determine the status of your long QT syndrome, and it's possible to determine if patients are carriers through the use of genetic testing. If there is something else you guys want to talk about, then...
Well, we want to have another baby, so is there any way we can test?
Yes,
For
there is something known as fetal magnetocardiography that can diagnose congenital long QT syndrome in utero, and studies have shown that this test can play a critical role in the diagnosis and management of long QT syndrome. Perfect.
I mean, like, is there anyone I can talk to? Like, this is really stressful. Like, I don't even know how to go about.
Yeah,
dealing with this.
definitely. There are a bunch of like foundations and support groups set up for people or families that go through this. So there's something called SADS Foundation, which is the Sudden Arrhythmia Death Syndrome, and this is a website that you can go on and get information about this condition and the syndrome for like newly diagnosed people. So it's helpful for patients and families, and provides like, even on this website, it'll tell you support groups like in local areas. And it seems like a very good, useful resource that patients have used in the past. And then there's also Facebook groups for more local things where you could talk to families. So you connect with people who are not necessarily in your area, but you could share your stories and help each other through different diagnosis, treatments, managements, and see what other people are also doing.
All right, guys. Well, I hope we can answer some of your questions. So I know this is scary, but it's definitely a completely manageable condition. We're going to get you set up with some more appointments with our cardiology team here, with our genetic counselors. We're going to talk about putting in an ICD. We're going to start you on some beta blockers. So this is you'll be able to live a normal life, and it's definitely a completely manageable condition. So we'll get you set up with an appointment with us in the future, and we'll get it figured out from there.